At 9:35, it's the Link on the Breeze 93.9. Let's just get right into it and bring on Dr. Kristianna Whitman of the Guam Behavioral Health and Wellness Center, the Guam Focus on Life project. And good morning, Doc.
Good morning, Chris. Good morning, Bree. Thanks for having me on this morning.
Of course, and we're also just you're also a licensed professional counselor in this. So this branch of Behavioral Health and Wellness Center that you head up, this is specifically dealing with suicide on Guam.
Yeah, so I actually am in the prevention branch of Guam Behavioral Health and Wellness Center, and my specific project is the Guam Focus on Life Youth Suicide Prevention Program. And it's actually, Guam has had this grant in the past, but we just got awarded it again earlier this year. And it specifically focuses on youth and young adults from 10 to 24 years old, but obviously, we look at the bigger picture of prevention in terms of preventing suicides on the island. And I actually got on board with Guam Behavioral just in the beginning of the summer, actually. I was prior I was at the University of Guam in the counseling department.
Right.
But my training is as a licensed professional counselor, and now I'm at Guam Behavioral.
Can we start then with the numbers, because we hear about it, but what are the numbers with suicide on Guam, and are these young kids or?
Yeah, so unfortunately, those numbers that I think that have been released, we haven't gotten that data. The official data that we report on is, or receive the reports on, is annual data. So we probably won't see the 2020 report until early next year. So I can't truly report on that, but kind of to segue or to add to what Kristianna mentioned earlier is that it's not a surprise that suicide is an issue on Guam. It's been an ongoing issue on the island. In 2019, there were 31 suicide deaths by suicide, and that was a lower number than the year prior, but it's still not, it's still not good enough. So we continue to do the work in prevention to hopefully minimize these numbers and someday get to zero.
Right. So, Doc, the numbers last year we had 31, and I'm just thinking if we have a whole federal grant that deals with the age group that you're working with, that's the biggest demographic that's taken their lives, Doc?
Actually, from last year, it was the 20 to 39-year-olds. So it's the young adults, really. And I'm glad you had Kristianna and the epidemic program on the show earlier, and I was listening in. We do a lot of work with them also in conjunction with, as partners. And they're doing a lot of that work in terms of partnering or reaching out to the college age students. We also do work with Guam Community College to identify some of the gaps in their services and how we can continue to improve or increase services. But yeah, we are seeing it. And then even with Suicide Prevention Month, we're trying to figure out what are the best ways to kind of reach that demographic of 20 to 39-year-olds. Yeah. So,
I mean, this is like kind of a loaded question, but why are people killing themselves?
Very loaded. I don't know. I mean, I can't. I don't even want to begin to speculate on that. However, I will say that the best form of prevention is in getting help. That's suicide is definitely preventable, and that's what we want to highlight in the branch. And as a result of our grant, is that with help, there's hope. And the hardest part, I think, for anyone dealing with any difficulty is getting that help, initiating that step, because it takes a lot of courage to do that. It's not something we talk about all the time.
Right.
And so I was catching the end of your discussion, and asking Kristianna about how do you talk to your kids. And I think that's the biggest thing, is we start talking to them and making mental health an everyday conversation. Like I said, I taught at the University of Guam, and one of my classes, I kind of start with asking my students about their conversations at home, with regards to mental health and with regards to suicide. And in a counselor preparation program, I think in 15 students, there was only one or two that said that they actually were kind of talked to, about these issues. It's not culturally, right? It's not something that it's not exciting to talk about, right? I'd say that would be the biggest step in prevention, is having the conversation and making it, normalizing the process of getting help and assistance,
Right.
even when it's not. Yeah, go ahead. Sorry.
No, I was going to say I'm glad you say that, because oftentimes in the media, it's one of those things where when somebody commits suicide, we kind of don't report on it and we don't talk about it. And yet we still see numbers that show that maybe it's time that we stop acting like it's taboo, and you're right, normalize it. We talk about it. So I'm glad that you said that, because it's always been difficult for me, like, no, we shouldn't put that on the news, but it's happening so frequently that
And I'm glad you said that, Bree, because there is actually, for the media partners, there are kind of guidelines for safe messaging
Yeah.
with regards to reporting on suicide. And along with not wanting to sensationalize suicide, we also want to always encourage people to seek support and seek the resources. So like I said, us just sharing what resources we do have is a huge step. And again, I thank you for giving us this platform to reach so many people, and remind them that there is help and there is assistance available. I guess I just want to kind of add is, on a personal note, I think people think that you have to be really, really sick in order to receive services, or you have to be kind of at that space of crisis in order to make a phone call to the crisis hotline, and you really don't. We're all going through our own stuff at home, and during training, when I was training the hotline workers, I kind of used a personal example about getting into an argument with my partner about wanting to go to brunch when people are when some of the guidelines were restricted, and it seems very superficial, but it was interrupting what I had known as my normal, my normal routine of things going on in my life. And so it was causing me to be a little bit anxious. And so just kind of normalizing the idea that right now we're not in a state of regular crisis. And even if we weren't in a pandemic, the hotline can be used and can be accessed for just wanting to have, some of us don't have regular support systems. And so let this be your first, kind of support system.
Doc, I just when you talk about a personal note, I have a friend that had someone in their family who was evicted, and this man took his life by drinking a bunch of bug poison. And my family, we had a nephew who hung himself. So when I asked you why do people do this, I only ask because that's the number one question on the loved ones who are left behind. They always ask why, and a lot of times they don't know why. So what do people say when you counsel them and they reach out for help?
Yeah, it's such a heavy topic, and it's even more difficult to talk about because there are those unanswered questions, and so we're left hanging. We're left not knowing, and unfortunately we'll never know the answers, right? Because we don't we can't unfold. And so I would say for those people who are left, kind of left behind, those survivors of suicide, the supporters of the person who died by suicide, is they really do need bridge to also, seek assistance if they need to. And I guess I would tell them, yes, maybe it was preventable, or the issue was preventable, but it's also we don't want to repeat something like that again. So maybe we can start to kind of have these courageous conversations about how to move forward without holding on to that kind of guilt of a suicide happening in a close circle of yours, because that's what happens, right? To the people who are surviving or who are left behind, is we start to feel like, what could we have done more? What could I have done? And I would say, what can you do is start to have that conversation with those you care about now.
And I think that's why it's so tough for a lot of the family members and the loved ones who are still here trying to make sense of it, because it really comes down to, what could we have done? Well, we could have talked to them, and to know that what you could have done was just so simple and could have made that difference literally between life and death. I mean, it's a heavy burden to bear for those people. I mean, not even considering what the people who kill themselves are going through, right?
Yeah, it is a heavy burden to fair. And like I said, I don't think the overall message is that we don't want you to feel like you're bearing that burden alone.
Right.
And so as a experience or dead by suicide, we would want you to also get the support that is needed. And so the hotline is available 24/7. I know you had our hotline staff on a couple of weeks ago, and they're ready and willing and to talk and be that frontline support. For them also, we do offer them support, the hotline workers. So I actually offer kind of like weekly office hours debriefing sessions to our hotline workers to ensure that they're also not burning out from being that frontline provider. Because it is a lot, even as the caller, even though they're anonymous and we don't know who's calling, it's a lot to hear those types of heavy issues. And we're all going through different experiences on our own also.
What about the training? So you mentioned you train these hotline volunteers. Are these just people like entry level people? And then can you tell us a little bit about the training? And then when you talk about having the open office hours, right? So Bree and I were just talking about this before we brought you on. I mean, it's one thing the people calling the crisis hotline, but for these volunteers to just hear these things, all day, it's got to take a toll. So there you go. What's the training like, and what do you counsel them when the people who answer the phones need the counseling?
Yeah, who counsels the counselors?
Yeah.
Right.
Yeah, so absolutely. So the training. So in March, I guess prior to the lockdown and stay-at-home orders. Well, again, this is stuff that was discussed when Helen and Sylvia were on a couple weeks ago. But we anticipated that there would be a lot more people needing services and needing assistance and needing that 24/7 access. So so we kind of redetailed people to work on the hotline. So these aren't always social workers or always counselors, but they are trained to provide hotline assistance, similar to the way we train people when we engage them in we would regularly do the holiday hotline. So it's similar training to that. There's always a social worker available though. So if the caller calls in and maybe needs additional services, we can actually provide the intake over the phone immediately. So they don't need to come in, or, that doesn't need to be interrupted. If they decide it necessitates and they would like additional services. And then I've been going in so that started in March, and we have multiple people on the hotline shifts every day. And we actually increased capacity in the amount of people who would also do intakes throughout the day. So because in anticipation for this kind of second surge of need, I went back and kind of retrained a lot of the workers. We looked at some of the gaps maybe that we were having and some of the kinks in the system, and we kind of retooled and then we also started to offer these open kind of office hours that I lead, and they're just real again, they're optional, but they're open, sort of a virtual support group for the frontline hotline staff. We recognized, I recognized in the training as I was going through the training that they really needed that additional support. Right. Because it is a heavy affair.
Kristianna, there may be somebody out there listening right now, out there at home, and they're feeling lost. They're feeling stressed out because they're not going to, they lost their job. What would you tell them right now?
I would say take a deep breath. I heard Dr. Margaret say that earlier, but it's so powerful. Just this, take a deep breath, and think about maybe what would today be about? What would you want to, what's keeping you here right now? And I think if you don't have a caring contact or a support available to you, then 647-8833 or 8834 is our hotline, and there are available caring supports who are willing to talk with you. And again, there are so many things going on right now that we don't want to, we want to make sure that people know that there is help. And again, we want to make sure that people know that you don't, need to be at the space where it's already kind of maximized. You know, you're already in a spiral to be able to get the assistance. I've utilized counseling services at different points throughout my life at various transitions, you know, whether it was in grad school or preparing to be a mom or, you know, different things. And it's always been a very helpful kind of tool for me to, or an outlet. So yeah, I guess to normalize that process is really important.
DACA, and again, when we talk about normalizing, there's just something, because I know people who have lost their young children. I'm talking teens, early 20s. And when you hear the reason, like some of the reasons I hear are they were fighting with their girlfriend.
Yeah.
Right. And this is just so tragic. And I've had this talk with my kids, because I think the young, when they have their heart broken, especially if it's the first love or whatever, they don't have the context to put it in, and or the coping skills, and they just feel that. I mean, we've all had our heart broken, and yeah, you do feel like you're going to die, but a lot of people don't know that you can get past that and you can keep living. So how do you, as a parent or as a Nino or Nina or auntie, because a lot of times our kids can't even talk to the parents. They want to go talk to Nino or Nina, you know, how do you have that conversation with your kids, especially when they start getting into that age where they're going to be dating, they're going to be, you know, checking people out? How do you have that conversation? Like, if this goes south, boy, and your heart is broken, it's not the end of the world. And I mean, it's not, we're laughing about it because it's like young kids in love, but it's so tragic because
And it's true.
people have lost their
Well, we've all been there. We
Yeah.
all know what that experience kind of feels like, right? To feel like this was the end all be all, and you know, this was supposed to last forever. And we've probably been on all different spaces where it didn't, it didn't last forever. So I would say, you know, as that kind of supportive contact, is that you want to validate that what they're feeling is okay, though. You know, that feeling, whatever feeling of heartbreak, of sadness, of, you know, is real. It's real to them. And just because we maybe 15, 20 years later realize that there's someone else out there, or there's kind of a way up, you know, they don't know that experience yet. So I think validating their feelings is really important. And then also kind of recognizing and checking in with them about, you know, kind of how bad is this making you feel right now, and being comfortable and confident in about either guiding them to assistance if you're not comfortable talking about it, or just asking them the questions, you know, is this making you so sad that you are considering suicide right now? You know, is this, and that's a very serious thing, and let's get the assistance that you need to be able to for that to not happen, you know, because but what happens oftentimes is that, you know, because it's not kind of a normal part of our conversation, and suicide is kind of scary, and we don't know how, we're afraid that we're going to say the wrong thing, or we're afraid that we're going to promote, you know, the suicide, we start to step away from that. And then what happens is that the person who we're close with maybe doesn't trust us enough to be able to handle that, you know, and so they might say, oh shoot, you know, Auntie T, she doesn't want to talk about, you know, she keeps kind of switching subjects. I don't think she wants to talk about this with me, you know, like, but if we're, you know, open and honest, like, hey, you know, it sounds like you're really, really sad about this, and I'm concerned, and suicide is really serious. Is that something you're concerned about? Then they know that you're ready to work with them, and you're ready to hear their story, and you're ready to hear, you're ready to continue to be there, like Kristianna said, to be the one to get them that support along the way.
And that's so key. I mean, I got, you know, everyone knows I got kids, but I've had that talk where, man, this is going to happen. You're going to love someone. You're going to be with someone. You're going to think it's going to last forever. You're going to get your heart broken. It's going to hurt. Yeah, it's going to hurt. It's going to be real, but you live another day. And I think just saying that, I mean, if you're just like in the dark and your kids are out there doing whatever and they get their heart broken, you don't want to be that. I mean, it's so tragic. You don't want to be that parent who's just sitting there, like we had said, asking why, and then you go on the phone and they were fighting with their chick. It's just, I mean, no one should have to come to that place. We just got to talk to people.
Right. You know, and connecting with them it's so important. You know, we keep using the social distancing term, and I don't want to say it bothers me, but it does a little bit, because, you know, we're not trying to social distance. We want a physical distance, but we really do want to continue to maintain connection, even if it's virtually. At the same time, we want to be able to watch there really is Zoom fatigue, or, you know, kind of online online fatigue, right? And so, I mean, I was feeling it this morning, and so just be mindful of that also. Um,
Would you say we're dealing with a mental health crisis on Guam?
I'd say that we're all. I mean, I don't know if I think it's an ongoing crisis. Until we if we're thinking about suicide, I think we would want it'll continue to be a crisis until we're at zero, right? I mean, that's in my opinion. In terms of our mental health capacity, I think we've been able to see this people, get the support that we've been needing. Guam Behavioral Health did get a couple of emergency COVID grants as a result of the pandemic, which has allowed us to hire a couple more counselors and social workers to support the increasing maybe need of the community. But yeah, I guess I don't know if that answers that question directly.
I just asked that because I know in the past suicide has been described as an epidemic on Guam.
Yeah. Yeah, it has been. And like I said, I think 31 is still, it's a lot. It's too much, and so we really do we need to focus on that prevention side and try to really, continue to do the work that we're doing. I think the Suicide Prevention Month is this month, and there's going to be a bunch of different things going on, even virtually.
Right.
And so I think you'll be getting a calendar soon, and maybe we can talk about that
Sure.
at another time. But as we don't want to lose sight of the fact that it's definitely an ongoing issue. And until it gets to zero, I don't think it's not going to be an issue.
Yeah.
No, we agree. Doc, thanks for coming on. And again, anytime, because we know it's Recovery Month too. Are you involved?
Yes.
Right.
Yeah.
So we want to definitely get behavioral health and wellness on the recovery side, but with the Focus on Life project and everything you're doing, keep in touch. And anytime you need to get the word out at all, we'll give you the floor and we'll put you on. Okay.
Yeah, we really appreciate it. Thank you so much again for all the work you're doing. You are also frontline workers, and so if you need support and help, the hotline is available to you also, and we would like to get you guys the support you need.
Thank you, Doc.
Thank
Well, while we
you.
got you here, there was something. I'm just kidding. You're gonna need a couch. You're gonna need the couch.
You
Can
need a
hang
couple
your
hours
phone
for this.
and then we'll do it. We can.
All right. Thank you,
Thanks,
Doc.
Thank you so much. You
Okay.
guys have a good day. Be
All right,
safe.
take care.
Wash your hands, stay home. There you go, Dr. Kristianna Whitman.
We need a whole
I
another
got
4
a
hours
friend. You see, I got a friend that he's
asking for a friend.
right, asking
Yeah.
for a friend. Right on.
No, but really, if
Yeah.
you need somebody to talk to, the number is 647-8833, 647-8833 or 8834.
Right, and then also,